En logoiwek chetinyegei ak tililindo kokaituiyo betutab raini emetab Kenya ak emotinwekab ng'wony ole kakimuch kibwat akobo miondo nebo ukimwi ole igorta nekinete biikab emet akobo tetutik cheterter chekimuch ketere mionoto ak kora kamanutiet nebo komong'e asikemuch kechikil ichek. Kaindochi igorita minister en ministry nebo tililindo Deborah Barasa ole kaimuch kong'alalen akobo kakwautik kikomuch koib serikalitab emoni kobun ministry nebo tililindo nebo kinet biikab emet ak kora keker kele kakimuch ketoret biik chekikonyor mionoto ole kamwa kole nyolu en stakeholders tugul koker kole kaimuch kobois en kibagenge asikikochi konetisiet biikab emoni.
This World AIDS Day is special to me as the celebration is critical to shape our discourse for the now and future generation who may have not had the chance to see and experience the epidemic in its worst case. We all recall the experience on our continent, the early 2000s, a negligible number of HIV-positive clients had access to diagnosis and life-saving treatment. On the health facilities, they were swamped with dying patients and doctors struggled to give their best to manage the onslaught of devastating opportunistic infections. Homes were filled with graves, orphans who were helpless filled our communities and our country, and all sectors lost a significant workforce, and the stigma in the communities was at its highest. It was devastating at that time, even as was said by Dr. Rose. HIV and AIDS crisis that threatened the social, economic, and development fabric of the country, and the emergency situation called for out of the norm action. The ravaging epidemic at that time threatened to wipe out communities if nothing was done, and done very fast. The Kenya government declared HIV/AIDS a national disaster in 1999, resulting in a national move towards creating awareness and advocacy for prevention of new infections. And globally multilateral investments through PEPFAR. Thank you so much, Brian and your team, and really we appreciate the great work and for standing with us throughout this. I have seen practically, even working in the HIV programs, what you have done, and we really appreciate your support, and equally for the Global Fund, who are really instrumental in terms of supporting us to reduce the HIV infections in our setting. Since 2003, the government and its partners have built the essential mechanisms for HIV/AIDS management and strengthened public health systems, which we even leverage